Thanks everyone for joining us here today. It's an absolute pleasure to have you at the Vonage Hub, and we appreciate you taking time out of your busy Dreamforce schedule. My name is Riley Matthews, and I have the absolute pleasure of moderating our consumer-centric healthcare in a hybrid world discussion today. You can see the Vonage logo behind me. I am the Strategic Alliances Manager for Vonage. I support our go-to-market strategy with Service Cloud Voice in our Salesforce partnership. We've garnered 17 years of developing communications tools in tandem with our Salesforce partnership, so look forward to speaking to that today. As you can imagine, healthcare is one of our most critical industries when it comes to the development of the contact center and advancing communications tools. Today we're going to discuss why and get into our discussion and how organizations are adapting. So here with me, I have my three esteemed industry experts in the healthcare and life sciences space. First, Samantha Murphy, the Global Head of Healthcare Industry Advisory at Salesforce. Lacey Van Sickle, the Chief Delivery Officer and Summit Partner in the healthcare space at Penrod, and Rahul Shirgapar, the Head of Product Management for SMS Magic. So, and if we can flip to the next slide, I'm going to give a little bit of background into a customer story, a shared customer that inspired today's conversation. And you should see it pop up on the slide. But to set the stage, we'll have a 30-minute discovery discussion, get into 15 minutes of questions and answers, and then our conclusion before we wrap up. So if we can go to the next slide, we'll see a few high-level points on the customer journey that inspired this conversation. An organization that transformed their treatment plan with digital solutions at the core. A few of the gaps shown you might recognize or even resonate with: multiple user platforms, poor call and chat quality, leading to low attendance and treatment completion, and poor agent experience. We do encounter them frequently in the healthcare space in the ever-evolving landscape. So to expand upon this, we'll explore today how communications affect patient satisfaction and treatment, how organizations optimize efficiency while maintaining quality and patient-centric values. And this is particularly impactful because we've all been on the other side of the chair, right? With an experience as a patient, a caretaker, a provider, and whatnot. So let's go ahead and get started. So I'll first start with Samantha. How has the patient care manager relationship changed over the past few years in a hybrid world?
So we've seen a lot of changes. So I'm gonna just stick to some highlights here. One of the changes that we've seen that I think is driving a lot, and certainly you're seeing it recognized in the title here, is the concept of consumerism. So the relationship and I am a clinician by background as well, so the relationship that has evolved over time, especially as we have come through COVID and quarantine and on the other side of it, is that we now see a consumer mindset, and certainly we've all been talking about that a lot, represented in the day-to-day, even face-to-face conversations and relationships that are built on that trust with your provider. And so let me just explain what I mean when I say that. What that means is we're looking for, as a consumer ourselves, we're looking for the care to be personalized. Everything I've shared with you, I would like you to see that reflected back in our conversations, in our messaging, in the preferences that I've told you about how I want to be treated and the care. It also means I want things real time. I want to understand the information that you have, and I want access to it myself. I want to be my own advocate and have you share that relationship with me. And I want things to be convenient. So not just on my own time, but I want to do it my own way. And so that, for Salesforce, we spent a lot of time thinking about that particular intersection and what that means. And in healthcare in particular, we've never been great at capturing preferences per se. That wasn't what we were asked to do up until now. And so for us, that's really been the biggest change that we've seen.
Awesome. And Lacey, do you want to expand?
Yeah. very much agree with what Samantha said here. I think one of the biggest things when it looks at transformation in the digital world when it comes to consumers is really thinking about our patients, our members, our stakeholders as customers. Customers today in the hybrid world can get quick access to customer service through other consumer-based platforms such as Amazon, and that same experience, that customer experience, real-time, like Samantha said, personalized, is something that our consumers are going to just start to expect in all industries, but especially when they're looking at their healthcare services.
Awesome. And Rahul?
Yeah, so today's world has really become digital first, right? So healthcare institutions have embraced medical charts and patient portal and allow patients to access to medical records and history on demand, right? So the same expectations has basically expanded to immediate communication, right? Patient wants to access the immediate care or access to the care via text, SMS, chat, online, right? And they want basically immediate response. So the pressure is on the healthcare institution to deliver that particular experience immediately and basically create great customer expectations. Yeah.
Yeah, and it is an interesting dynamic, once again, being on the consumer, on the patient side too, having the expectations as well as coming from the organization standpoint. So let's get into patient satisfaction. How has treatment patient satisfaction been impacted by virtual care?
Yeah, go ahead. So when we talk about satisfaction, we certainly can't exclude the concept of satisfaction scores. So if we can broaden to healthcare, two big things have happened. Certainly we've talked a little bit about the consumer mindset, and I'll get back to that in a moment. But two other things have happened. Number one, CMS told us that satisfaction is a big component of Medicare. So we saw them increase the weighting of satisfaction scoring and their CAP scoring. And certainly there was a big response to that started out with the payers and cascades down to providers and is reflected in those moments. But when we go back to the patient-member relationship, it's reflected in those moments. It is seen as an expression of the health plan when you're interacting with the network. So that's one component that we saw impacted. And then the other one is we know that as members or as patients, whether we're looking at who we are choosing for a provider or who we are choosing as a health plan, we have more choice than we've ever had before. And what that means is when we want our preferences reflected, we want our personalization reflected. We are now consumers. We're not just given one or two options and left to our own devices and to just deal with it. We actually have a voice now, which is everything we've been asking for in healthcare. But the demand is now to see it reflected. And when it's not, what has come along with that consumer mindset is there is an expectation, well, one thing, on the other hand, on the other side of the COVID quarantine, we're now more willing to share data. It used to be the case that we were a little iffy and the field was a little iffy, especially when you got to healthcare with sharing data. Now we are for sure seeing people more willing to share their data with their health plans, with their providers, with digital health companies. But the expectation is once I've done that, I would like to see that expressed in the way that my experience is throughout when I navigate the system. And when that does not happen, so calling me at a time I told you I don't like to be called, pronouncing my name wrong once I've told you what it is, telling you that I would like to work with a female provider and you gave me a male, the satisfaction scores are impacted immediately and higher than they ever used to be.
That's a great point. And to the point of sharing information, how much patients are willing to give, we'll get into compliance and address that shortly. But Rahul, any additional thoughts?
Yeah, virtual care is so valuable in today's world, right, where the medical facilities are maxed out, right? A part of a good experiences is providing immediate good communication, right, between patients and the providers. We at our company have seen healthcare institutions using SMS and chat, right, to interact with patients and And these channels are basically core and integral part of today's virtual care model, right? So that's what I would say. Yeah.
Great. And to transition a little into specifically quality, Lacey, I'll ask this to you. How can organizations transition to hybrid remote flexibility without compromising quality?
Yeah, so we talk a lot about how it's really important to have a hybrid experience for our consumers. I think it's also equally important to have a hybrid experience for our employees that are supporting those consumers. So providing a way for your team to be able to connect with each other virtually when not everyone is in the same office is really important. One of the things that we have seen is when you aren't in that in-office area, the amount of institutionalized knowledge isn't always connected throughout your employees. And so one thing that really aids into retention of your team and growth of your team is engaging your frontline employees and asking them what are better ways that they can provide an exceptional experience to your consumers. You should be engaging in platforms that reduce the risk of that institutional knowledge not being communicated internally to your hybrid employees through things like a call center, Salesforce knowledge articles, and really focusing on then testing and measuring that impact. So retention of your employees is really important to then be able to better service your consumers. And those frontline team members that you have who want to work in a hybrid environment are the ones that can really tell you what do they need in order to better respond to your consumers and provide them an exceptional experience.
Awesome. Rahul, what about you?
I can basically skip this question, please.
Definitely. So more specifically, Lacey, and I know you just addressed a couple of stats, but can you share an example of how the onboarding process for agents is changed?
Yeah, so at Penrod, we've seen examples within the healthcare space where streamlined onboarding, streamlined workflows, streamlined technology for your employees can actually reduce the amount of time it takes for you to train customer service reps by 50%. So one of the things that we really see when you think about health plans is during open enrollment, there is a way larger call volume needs during that open enrollment. And so a lot of health plans are able to actually expedite and provide better customer experience by onboarding temporary customer service agents. But imagine a world where that takes 4 to 6 weeks to onboard someone who's supporting you just during open enrollment, right? You're taking a lot of financial investment in that training. So through things like call center workflows, integrated call center technologies, we've seen where you can actually reduce that 4 to 6 weeks to 2 to 4 weeks onboarding. So you're able to really ramp up your customer service team to support your customers during that high volume time. So this can provide a lot of very cost-effective impacts for your organization.
Totally.
Yeah, if I could add to that, I mean, when you're thinking about the call center reps, and once you have them trained in particular, they are now a very high value resource for you. And so there's been a lot of emphasis put on what does it actually feel like to onboard in a way that feels natural, to make sure that your call center reps are people who feel good in that role, and so that is reflected in your brand as you are, whether you are provider, whether you are payer, or even one of the brokers or government bodies that are interacting with the healthcare consumers. So when you're thinking about where that is and what that actually feels like to do, a lot of the customers that we've been working with are looking for very diverse backgrounds in their customer service reps to be reflective of the communities that they're serving. And what that means is you'd actually need a way to do that where you're reflecting the preferences and understanding and cultural competency of not just the members or the providers, but you're thinking about who's sitting in the seat. So the onboarding that we're really talking about really has to have that full perspective. It's no longer just facing out, but there's a lot of emphasis and thought about who you want sitting in the chair, what you want it to feel like, and how quickly you can get them there and hold them there so that in that role they feel like they're making the type of difference that they hope to when they signed on with you.
Great. And a very critical component to this entire conversation is automation, right? And it wouldn't be Dreamforce 2024 if we weren't talking about AI and automation. So Samantha, can you specifically address how healthcare organizations have been thinking about compliance and governance when it comes to AI and automation?
Yes. And actually, even before that, I'm going to stay on workforce for a second. I'm just going to include the concept of AI and kind of where we see that sitting. We just heard the announcement that we have Einstein Copilot now, which is a generative AI-powered assistant that is going to be helping with natural language to be able to infuse that into all CRMs. What does that mean for your call center rep or for your compliance? What that means is initially when people thought about AI, and this has not gone away, there was a perception of threat. Does this mean that we're going to have less workforce for everything? This can be seen as an opportunity, especially the natural language and the ability to do that in a way that is more inherent to your natural workflows or the way an individual likes to work, that you can actually start to think about expanding your workforce. So you can take some hands off keyboards. What does that mean? That means you might be able to have people work longer if they would like to do so. That might mean you might be able to have different types of people that weren't so familiar with the use of the technology or the language that it was using interact with it that way. And so one thing I do want to say is it's really nice to be able to see a potential expansion in terms of who you have using the technology in a way that suits them, and you can actually meet the performance goals that you're going for. In terms of compliance, certainly when we're talking about this, we're talking about automation, efficiency, and a lot of people are starting with things like summarization. In healthcare, obviously, we're thinking about trust. We're trying to figure out where bias can happen. And so a lot of our customers, and where I would definitely recommend starting, is to make sure that we're seeing, especially in a compliance setting, that we're seeing AI as an enabler of your strategy, not the strategy itself. So, when we're talking to our customers, and I'm working with a lot of the payers and providers that are looking at doing this on the earlier stages of things, generally my coaching is to be, number one, look at your strategy. Where were you trying to go and where would you like to be? Where does AI enable that strategy? And then along with that has to come the concept of governance in a cyclical way. Because AI learns faster than we do, that has to be a cyclical process that is ongoing, and it goes throughout the organization so that you get the full perspective of everyone touching it.
That makes sense, and that kind of makes me think too about down to the granular data. How are you seeing, organizations prioritize accuracy and being able to leverage that data? To your point there of it being an enabler, not the overall strategy.
Do you want me to take?
Yeah, go ahead.
Okay.
Yeah, you got it.
So this is the moment where everyone knows that good data is what drives better decision making. This is the moment where we're really starting to see organizations start to pull data into the same place and look to normalize it. I know that is much easier said than done as being on part of that. But in terms of accuracy, that's part of what the compliance is. We know that AI is going to draw things from you can give it boundaries to operate within, to oversimplify here. You can give it boundaries to operate within. But the question of accuracy, we have those questions interdepartmentally, right? I pull a report, it doesn't mean the next department thinks I'm reporting on what they think it should be. So that the concept of governance and compliance has to be constantly asking that question, and there has to be, especially where AI is involved, a focus on improvement of it. So you have to be willing to ask, are we adding bias here that we didn't perceive? Is it only interacting, if you're using the chat function, is it only interacting with a certain demographic or a certain segmentation of my population? If that's the case, what is that doing to the data? Is it learning from that? Is that driving decision making for us that we should be considering that bias? So those are the areas. It's really that governance question is really where that becomes important.
Definitely. Ever expanding. So another critical component when we're thinking about omni-channel messaging, and keeping everything in a single pane of glass, the integrated tech stack, right? And improving the agent experience, improving the patient member experience. Let's talk a little bit about the value of the integrated tech stack and where organizations can start in improving the overall experience there. And Rahul, do you want to kick us off?
Yeah. So the team with a distributed team becoming a norm, right? It's very important that you invest in the right technology for your remote workers to access it, right? You need to make sure that those systems that you're going to take integrates well with the other systems. If not, then at least make sure that it basically matches with the latest interoperability standards, right? So that data sharing can be easy for the companies to push it to the across systems. The other thing that typically one needs to be aware of is leveraging other health tools, right? Remote monitoring systems. Or you can start basic, like have regular check-ins and basically reminders for those check-ins. And basically provide training and support to your support agents. Yeah.
Great. And Lacey?
Yeah, so let's start with the value. And we've talked a lot about the importance of a hybrid consumer world and technology being hybrid, but I think it's good to also talk about what is the overall value that your consumers and your employees get from that. So from a integrated tech stack, similar to what Samantha was saying earlier, you now have the opportunity to be able to see the entire consumer interaction with your organization. You're able to see how they've interacted with your healthcare or life sciences company. You're able to see their preferences, so you can provide them a personalized experience, so they feel like even if they're talking to a different customer service agent, that you already know them, and it doesn't feel like this disconnected experience. So there's definitely that improved consumer impact. This can allow you to reduce call time since you have that information right at the tips of your fingertips. And then as well allows your employees to have a better experience because your tech stack is now integrated. So they're not jumping into 5 different systems to be able to answer a question for your consumers. And so what this can do as well, so now you're minimizing the number of applications you have to manage for your customer service agents because they're in that integrated tech stack. You also can have some financial improvements in your organization by not having that additional overhead from different applications because you're viewing this information from one centralized platform. So one of the things, I think the second part of that question is like, where do you start? How do you start something like this? So I think the first thing that's really important is to really build a vision. What does it mean for your company to provide an exceptional experience to your consumers? What does that look like to you? What does it feel like? To what Samantha was saying before, what do you want your brand to exude every time someone interacts with your organization? And figure out what that end amazing state looks like. And then I think you also need to determine who internally is going to champion that vision. Who is really passionate about it? Who's going to help your team with change management? And who is going to be the one that says, hey, we're making our progress towards this exceptional experience and what that looks like. Then I think you need to start building a network of trusted advisors. So that's technology advisors, that's industry experts, and really looking for people who understand your industry so they can help you along that journey, and they can also help you with best practices in your industry. And I think that's really important because transformations are more than just the technology. It's the experience that your team goes through when implementing that technology. It's the experience your customers see as that technology is being implemented. And that takes a lot of change management. So you really want those trusted advisors who understand your industry to help you through that whole process. And then I think the last thing that we see that's really successful for our customers is strategically pick where you start. Transformations can be huge, they can be scary, they can have bumps in the road. That's going to happen in large transformations. So understanding really the important place to start is super important because then you can have small impacts and grow upon those impacts. You don't need to solve the entire customer experience problem in one technical transformation, but you can get there effectively, and that will not only show your consumers that you really care about them, but it'll also show your team that it's important to you that they're able to best service those customers.
Makes sense. And Samantha?
I think the one thing I would add to that is, so Lacey described really well like, how difficult it gets and what it's like during a transformation. I'm just going to kind of re-emphasize a certain point. I think one of the things when you're looking at the tech stack is to have the leadership team, not, full of champions, but also setting the vision and prepared to engage and continue to drive the vision when it gets difficult. It's going to get hard, and the thing that really can rock a transformation is an unclear vision or a unclear commitment to the vision. And so certainly I would say for those of you in leadership positions that are guiding transformations, your presence and engagement and clarity of vision to that team that's going through the transformation could not possibly be more important. And when you're doing that in the vision and when you're thinking of the tech stack and all of the details that help you get from where you are to where you want to be, the way we think about it, you heard me say, there's two components. It's the experience. What we're really talking about is what experience you want for the people that are interacting with you as your patient or as your member, and also how it feels to use the technology stack that you're putting in place. And so we like to say when we're thinking about it with our customers, if we're really doing it right, and this is really about relationships, and it's about guiding an experience towards that consumer-centric mindset where you actually have the demand to be better than you currently are and to achieve the vision that you've set, it should feel essentially as though the technology fades away. It's just enabling those relationships, and ultimately you get down to that provider-patient relationship again, or you get down to the care manager-member relationship again, or the CSR member. Ultimately, if we're doing it right, you shouldn't feel the technology. It should help you feel as though your voice is heard better by using it.
A solution rather than an offering.
That's right.
Awesome. Great. Well, with that, we'll wrap our discussion, but we have plenty of time for questions, so we'd love to hear from the audience, get a fresh perspective, and any feedback or questions you have. Yes. Let me come down.
How do you see AI changing some of these interactions across multiple channels, working with members at, say, at the plan might buy a product, and then now working with their provider and that interaction, and so that it's kind of a seamless interaction?
So I'll even expand that. What we're seeing in healthcare is not even just the payer-provider interaction and the seamlessness needed there, but certainly there's both compliance requirements, contractual requirements, and then also preferences driving those. So that's correct. I'll expand it to we also have other stakeholders. We certainly have caregivers that need to be part of that are important parts of this. We also have community-based organizations that in some places are requirements to be part of that, or have delegated care management agreements that actually carry requirements, or it's just necessary for better care. So certainly engaging and being able to use that omni-channel engagement and understand the preferences of how to get back and forth to we didn't talk a whole lot about providers, but certainly they carry preferences too. So being able to understand what those preferences are, both member, patient, provider, stakeholder, and deliver in the way that they've asked to be interacted with is the thing that drives engagement best.
Yeah, so I'm from SMS Magic. So what we have seen in the healthcare segments, so there are like different kind of data storage softwares people use, EMR, marketing software, CRM, then SMS Magic. And every tool has a different way of communicating with the customers. So we see like the SMS Magic they use for patient communication. EMR is already sending some messages for patient reminder or something. So from the customer perspective, how do you see like these all tools coming into the same kind of the converging into the one, providing the one single experience?
Can you repeat the last part of that question? I didn't hear the last part.
Yeah, how do you see like customers coming to the conclusion of using like single kind of the stack to cater the uniform consumer experience?
Yeah, that's a great question because when you look at a healthcare technology stack, your customers can have preferences in so many locations. They might have gone into their provider and shared a preference that's in their EHR or EMR. They might have called your call center and shared preferences with your call center agent. They might have interacted with a newsletter and email and shared their preferences there. So what we've seen is most successful, and there's different technologies you can utilize for it, but have a centralized place where all those preferences are stored and determining what is the master preference. So having an integrated tech stack where you can see all of those interactions, you can even ask your provider, your member, your stakeholders, hey, we saw when you last visited your primary care physician that you shared this preference. I'm hearing you say you want to change that preference and kind of confirming that with them. And so that's the importance of having it in one location or integrated into one location, because a lot of times as people go through their healthcare journeys, those preferences might change. Where at one point they might have felt really comfortable with a telehealth interaction, they might decide they need a little bit more of an in-person communication. Or as their caregivers change, their caregivers might have different preferences as well. So does that help answer the question? I think really you want to look at what's that centralized location, because your consumers are going to share those preferences across all the different ways that they interact with your organization.
And I'll add to that if I can briefly to say that, so it is possible. So I know, and we're saying it and it sounds easier than it is to do. But even in the more complicated situations, so if I were to call upon a value-based arrangement where we have attribution, so we have members that might move, or that there's some amount of churn, or let's be honest, we're in the middle of Medicaid redetermination where we have people moving in particular. What we are seeing and certainly would advocate for is the use of a golden member record. Again, easier said than done, but not impossible. We are certainly seeing people do that. It becomes important on the provider side in particular to get that interoperability going between the two units, not just for the better care, although that is certainly the case, not just for preferences, although that is certainly a key part of how to improve health outcomes, but also because that is the way to actually start having the member's voice and preferences actually represented in the healthcare delivery system. That's the way to move it. So it is on all of us to figure out how to do that. We are actually seeing that happen all the way through, and the providers, because they are often the through line, even when there is churn, even when attribution changes, do have a lot of that information. And so that interoperability becomes really, really important. But of course, when you're looking at an EHR and EMR, that's a very individualized function, whereas when you're looking at a CRM, that's your scale, that's your broader 360 that helps to complete the picture. So is it important to do both? Yes, but even more important that we figure out how to work together on this.
How do you see the adoption of AI, or maybe expectation of the patients or the healthcare professionals, of like how much they are expecting the AI to solve their problem, or how they are looking forward to the AI helping them or taking them ahead in the technology adoption?
So it depends on who we're talking about. Again, part of the consumer mindset is that there is a demand for, if there's a way to improve this for me, that you do it. Certainly, the awareness of AI is out there. The understanding of it, not quite as far along, but it almost doesn't matter. You certainly have different. Salesforce actually just did a study on this, and I'm happy to share it. I'll post on LinkedIn so we can all look at it, but. In particular, what was interesting is, and maybe not even that surprising, is the way that the different generations are interacting with AI, but that follows the expectations of how it's reflected back to them. So certainly we have, unsurprisingly, the Gen Z and the millennials leading the pack in terms of where they feel they are in terms of mastery. Gen X is following pretty closely behind, and then we have the baby boomers who are waiting to see it improve their lives meaningfully. So how is that expressed in the patient-provider relationship? The expectation is that if I can use this, I expect that you are too, and you should have something better than I do. And if it's available, if it's available at all, the expectation is that you use it. So the demand is way ahead of where we actually are in terms of trust and understanding and compliance and regulation is the truth. So where am I seeing a lot of our customers think about AI to meet that? Service in particular, summarization, so that you get that technology back, fade out so that you get the face-to-face engagement. We are seeing some of that, and those will be meaningful improvements towards trust, towards relationship building, towards listening, and spending your time, especially as a provider, sitting in front of the person that you went to school and did all of this person to help. So.
Yeah, I think to add on to that, and something Samantha mentioned earlier, is the technology side of it, your consumers, you don't want them to see, but you want that to enable you to have more face-to-face interactions. So you want to be able to enable your providers to have those conversations versus spending all of their time potentially doing research or, figuring out the right answers and using that to have more face-to-face interaction. So I think the important thing when you look at AI, especially in the healthcare experience, is your consumers should feel like they're interacting with someone from your brand. And I really think it's important to leverage it so then your people can interact more with those end consumers and spend their time focusing on those exceptional experiences with them versus working within the technology.
Yeah, it will be, just to kind of follow up on that, it's going to be very interesting for us to watch, especially as summarization is one of the front lines that we're seeing AI being used. A lot of those face-to-face conversations are personal and things that you wouldn't necessarily want summarized. So we are going to see a lot of the users, especially as all of us are learning to do this, and certainly we're here, so this is of interest to us, but we may be a little bit further along in terms of understanding how to work that technology. It might be a lot, we don't know how far ahead that's going to be versus where people need to be as patient and consumer advocates themselves. So there is a gap there that I think in the healthcare space we're all going to play a role to help fill.
Hi. So I heard, I wasn't sitting here when you were talking about it, but I heard you talk about vision, and you don't use your technology as the strategy, but more sort of to enable your strategy, right? So it's challenging, right, for someone like myself. I've got a vision for how my company should deliver customer service and what that might look like, and I can fantasize about it all day long. But I also don't have necessarily the depth of technical knowledge to be able to say, we could use AI to summarize the case notes and stick them right in Salesforce for you and move on to the next thing before. I don't know everything. So my question is, in your experience in watching, let's say, smaller companies implement or develop a vision and marry that with the technology, what's a success? The ones that have been successful in doing that, how have they gone about that? Do they research all the technology? Do they come up with this pie in the sky kind of vision and then ask the technology people to deliver on it? Like, how do you be successful in that?
Do you want to go first on that? Yeah. I was going to say,
This is in my... Can you guys hear me? Oh, yeah, there I am. This is in my wheelhouse. So obviously I'm a little bit biased being a technology and healthcare and life sciences industry partner, but I think it's really important to find not just technologists that understand the deep technology, but partnering with an organization that also understands your industry, because they can close the gap. So they can help say, hey, your vision is going in the right direction, or what you are seeing is something we see as best practices in your ecosystem, in compliance standards specifically to your industry. And then they can say, okay, yes, your vision is great, you're on the right path. Here's the technology options that you have and how you can go about it to implement that technology. So I think it's really important. You don't have to be an expert in everything or in all the technologies, but partnering with people who are experts in both your industry and technologies that you're looking to pursue.
Yeah, so I wouldn't say that you have to know everything, but there will be decision points that those teams will have to make as they're going through the steering processes and all the work that they're doing, where you'll want to be able to inform some of that. If we do this, does this get us closer to or further than? And it's in those moments having leadership support and vision clear that is really meaningful to keep that project moving forward. It is in those moments where people don't know if they've made the right decision, or in good faith they thought they were making all the right decisions, and on the other side it's like, this is not what I thought. It's those moments that really will rattle a transformation. So, steering committee is a really nice place to be, to say, if we do this, what happens here? And it's those kind of moments. But getting involved in every little detail, I've not seen that necessary yet. But certainly trusting the team that can do it and knowing that someone will communicate to you the important decision points when they happen, that has been key.
Yeah, and I think another thing to consider, just to add back on to that, is you will think that you are making the right decision as you go, but it's really important to understand that a transformation, you're going to test, you're going to implement, you're going to measure, right? So starting with something that's maybe a smaller component of your overall transformation strategy, confirm that it works, pilot with some of your consumers, get focus groups from some of your consumers to let them give you feedback of, are you actually achieving the vision? Because then you can test, measure, and then roll out. Because I think one of the biggest things when you look at technology, you get one shot. So if you're rolling out something that actually doesn't enhance that consumer experience, they might not come back. So having trusted, not only like a trusted advisor to help you, but having consumers that trust you and can help guide you, I think is important as well.
That's great. What other questions do we have? Awesome. Well, thank you all so much for joining us here today. We really enjoyed having you and hope you enjoy your time at the Hub. Once again, relax, get a coffee, speak with the team. Our panelists will be hanging out here for a minute. We have contact information for each represented company on the screen, so feel free to use that. I'll be here as well. So thank you all so much for joining us today.
Thank you. And happy Dreamforce.
Riley.
Happy